Hello, 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 and welcome to season 2 of Better Together, sharing our lupus stories. My name is Chanel Gabriel, and we are all the way live, and we're going to be talking about lupus. Please welcome to the virtual stage my co-host, the wonderful Dr. Michaela Bayard.
Hi, Chanel. So excited about tonight's show. We are going to be talking about pregnancy and family planning.
Yes, yes, having babies and not having babies. There you go. And we want to hear from you. If you are here and you are live, please send us a comment or a question in the chat. We'll try to get to it and bring you into this conversation. And Dr. Michaela, I have to ask you, so as a rheumatologist, what do you talk to your lupus patients that are pregnant? What do they talk about with you? And what's that conversation like?
I think there's a lot of questions because there's so many mixed messages out there like, can I get pregnant? What should I be doing? Can I be on medications? What does it look like to manage working with my OB or my GYN and my rheumatologist? So these are actually conversations I try and start early before people are pregnant because we really want to get to all the important pieces.
And I think that's so interesting. It's only recently that I started talking to my rheumatologist, and she was like, "So family planning," and I'm like, "Wrong doctor. Why am I talking to you about that?" And never thinking about how important it is to have a rheumatologist be in that conversation. And I know that we're going to be talking a lot about pregnancy, but I'm being selfish. I'm definitely going to talk about the not getting pregnant part of family planning. And I think that there's a lot of things that are also told to us that we can't take things that would help us prevent pregnancy. And what are those safe things? So I'm very excited. I definitely was going so hard to make sure we had this conversation happen. And so, yeah, we're going to have it. And yeah, this is going to be a fun conversation. So, what, for you as well, like Dr. Mika, do you have those moments where you're sending them to the OBGYN? Do your patients think about that?
Yeah. You know me, every time we're on the show, I talk about, your team of providers and especially for women and women who are in, reproductive age in their 20s, 30s, 40s. It's really important to have an established OB. And I really talk a lot to the OB when people are pregnant about the medication, how the patients are doing. I probably see people more before their pregnancies and during their pregnancies, like when they're planning. So it's really a teamwork.
Definitely. And I think we're bringing another member of the team here. We have so many great guests that are going to be able to talk about their experience being pregnant with lupus. We got some babies in the building. I'm very excited to see the babies. And our guests are going to be also bringing some of that wisdom that we need, that teamwork that we need. So here to share their stories on pregnancy, family planning, and lupus. First, we are going to meet Mom LaMesha and her newborn baby girl. Yay for babies. Look at that bright eyes. Oh my goodness. LaMesha is a mother of 4, including 10-month-old Colton. She's also a risk analyst and a small business entrepreneur. Okay, starting out as a way to help her kids with a skin rash, she turned their necessity into a full line of natural beauty products. They are called Naturally Me. So you might want to pick those up, but we're going to hear a little bit about it when LaMesha comes here to share us her production. And her natural production, Little Miss Colton. So later we're going to also meet identical twins, moms. They're twins and moms, Sherita and Talia. Sherita is a graphic designer, a brand consultant, and the oldest twin by 2 minutes. Okay. I'm sure she pulls that out on a regular basis. But you might have seen Sherita on CNN, ABC, Fox, and more. The former Gannett newspaper reporter is now the owner of the Urban Classic Design Studios, which is a celebrity brand development enterprise. So we got it. Look, styling right there, letting them know, right? So now we go on to her twin. Talia is a producer, director, author, and award-winning playwright. Her honors include the Delta Divas Rock Award for Community Service. Okay, that's my twin. Oh my goodness. All right, the NAACP Achievement in the Arts and the Juneteenth Community Service Award. So my family in the ATL, if you are there on February 17th, next year, 2024, you can see her next production, Sneaking with the Deacon. Ooh, scandalous. It is one night only and free. So we're going to get some details at the end of the show, but we want to make sure that we shout out all of the amazing things our lupus warriors are doing. And twins Sherita and Talia were both diagnosed with lupus. And both had their first babies during the same time. A period of time. So that's going to be a story. What does it mean to be twins having babies at the same time? So that's an introduction. That's just the first part of the show. We also got to close this out with an OBGYN. And we have to bring the other expert in the building. Dr. Afriye Amerson, aka Dr. A, is an active advocate of women's health, has been in practice for 20 years, and Dr. A has been a featured expert. He's been in these streets, okay? Many TV and radio shows, including Montel Williams, Tyra Banks, Tom Joyner's radio show, PBS, and an Emmy Award-winning story on postpartum depression. So tonight, she's going to tell us what to expect when you are expecting. And later, we're going to have a little quiz, a little baby knowledge quiz with our Better Together game, #BTG. So stay tuned for details. All right. And this is going to be a great show. I'm very excited. Whew. We're doing a lot. And
so we want everyone to be comfortable, have fun with us. We also want to make sure that we all keep in mind we're really here to learn, trying to advocate for each other. And, the big thing to keep in mind is how do we continue to learn? And I think this is a conversation we've touched on a lot, Chanel, but I think one thing that we're really trying to send the message about is that, supporting clinical trials where we get a lot of our information about research. And this is one of the best ways we can get important data. And if you haven't heard our other shows, when we talk about clinical trials, these are when patients participate in trials. So if you're interested in finding out more about what they are, if you want to think about being a part of these, please check out biogentriallink.com. It's right here at the bottom of our screen. So check it out, read a little more about what clinical trials are, because I think it's a great way to really feel a part of the progress we're making in lupus.
Yes, and thank you, Dr. Mika. You are absolutely right. The trials are so vital, and they're doing what they definitely have ones that relate to people that are pregnant. So make sure you are considering that they're vital. And you know what else is vital? Sharing our lupus stories. So we're going to go straight into segment 1, which is going to be have our first guest in the space, meet Mom LaMesha and meet the newborn baby Carthon. Carthon came into the world, 9 weeks ago? Well, welcome to the virtual stage, LaMesha. Hi.
Hey.
So glad to have you. Where's my baby?
He's right here.
Look at the little bow. Oh my goodness. So cute.
Beautiful.
Absolutely gorgeous. And how is she doing? How's the baby?
She's doing pretty good. Yeah, she's been doing wonderful.
Oh, awesome. Awesome. Well, we're so excited to hear all about what the process of bringing Miss Carthon into the world and all of that and your story. But can you please first tell us your lupus story? How did you come to the lupus family fold?
Okay, so I was diagnosed June 19, 2014 with lupus. I actually had just given birth to my third child, which is my son, Kendall. During that pregnancy, I had lost maybe 70 pounds. Every joint in my body basically was hurting. I hadn't been diagnosed yet. So during the pregnancy, I would have trouble, with my weight loss, hurting all the time. I was always tired, sleeping. I would be at work, sleep. And so it wasn't until I gave birth to him, he was like 5 or 6 days old maybe, and I went to pick him up, and this newborn baby felt like he weighed a ton. I couldn't pick him up. So I told his dad, I was like, look, I can't pick the baby up. And he was like, what do you mean? I was like, this baby, he's heavy. He was like, thinking I was playing. He was like, well, I give him. So when I laid down, like my wind, like my breathing kind of like cut off. So, you know, I jumped up and I was just like, something is going wrong. So that night I slept just sitting up, like sitting straight up in the bed. So the next day I went to the hospital and they said, okay, well, maybe you have gas. So they treated it as gas. I was like, nah, this is something different, you know. So the next day, same thing, I was having these chest pains. The chest pains started happening.
So you having chest pains regularly. It continued on.
Yeah, every time I breathed, I was having these chest pains. I was like, you know, something's going on. So I went back. They was like, okay, well, it's just gas. You just got to let it pass. I was like, this is not gas. So the third day I went back, I'm like, look, I'm not leaving this hospital till you guys tell me what's wrong with me, because this isn't just regular postpartum, you know, blues or gas. Something is going on. So it just so happened when I was at the hospital, I started running a fever. My fever went up to 105, and that immediately put me in ICU. So I was in ICU 10 days. They were running tests day in and day out, and it wasn't until the 10th day they came and told me, hey, you have lupus. And I was like, you know, when you hear those words, it's kind of like a death sentence, because I know what lupus was at the time. So I was like, where did I get it from? You know, I didn't know, you know, it's autoimmune or nothing. So I was like, where did I get it from? I was like, okay, you know, but like during the pregnancy, we didn't know what it was, because I'm the only one in my family with lupus. So the symptoms, I couldn't pick up what it was, you know, and they just stated one test doesn't tell you that you have lupus. It's multiple tests that you have to take. So that was when I got diagnosed with lupus.
Thank you for sharing.
Thank you for sharing about your symptoms. And I think it's so common that it takes time to be diagnosed. And even though you didn't know exactly what your symptoms were, it's amazing that you really advocated for yourself to make sure people were searching more for an answer. So, absolutely, you know, kudos to you. I'm so interested in hearing how your pregnancy went in the next baby, Colton, because now you had this diagnosis. So how was it different?
Well, before I got pregnant with Colton, following the year that I was diagnosed with lupus, my lupus went into remission in 2015, because early on I learned my triggers, you know. So I learned my triggers and it went into remission. And so I was told I couldn't have any kids because I was on the methotrexate that, you know, it kind of keeps you sterile, if you want to, I guess, because I guess they say it kills the cell. Like if you try to reproduce, the methotrexate will kill it. So
yeah, I mean, I have to step in here. You know, methotrexate's a medication that a lot of patients with joint pain and other complaints have who have a diagnosis of lupus. But, you know, we really try and avoid pregnancies when people are on methotrexate, because we're worried about the actual baby's birth and health, but it actually doesn't mean that you can't get pregnant. And, you know, it's a really common misconception. So I'm glad you brought that up.
Yeah, so I was told that I couldn't get pregnant on the methotrexate. Obviously, that was a lie, because I got pregnant with Colton. Colton's pregnancy was total opposite. It was like my first two, normal. I had morning sickness maybe like the first 2 months, but after that, it was like smooth sailing. I mean, it was a good pregnancy. The only thing, when I had her, she lacerated my cervix. And I was in ICU behind that. But other than that, my lupus was dormant the whole time. I was on Plaquenil. I even stopped taking my steroids, because that's what I used to use to kind of manage my lupus. But since I was pregnant with her and was taking the Plaquenil, it's like the Plaquenil just did it by itself. So I haven't taken a steroid in maybe like 3 or 4 months. So I've been good.
That's great to hear. Yeah, and thank you for bringing that into space, because I think that, you know, while every case of lupus is different, you know, I do think it's important to hear folk that are like, I actually was fine, you know, and I was able to have a symptom-free situation. So, well, we got to at least talk about this. Your beautiful baby. This is your baby's talk show debut.
Yes, it is. And she's asleep.
Oh, you know what? That's how easy this is for her. She don't even need to work. She's a star without even trying. That's what that is. Tell us something special about her? I'm just, just bring a nice thing about her. How's it been?
Well, I will tell you, with all my kids, they bring something different. Like they bring in a different element out of me. So, like my first daughter, she brings in strength. My second daughter, she brings patience. My son, he brings me love, and she brings me peace. So it's different. Like she's like she's peaceful, but like her whole how she got here and me and her dad, it's just been peaceful. Like it's been wonderful.
So was planning part of that piece? Did you, have conversations with your OBGYN or your rheumatologist leading up to conception of Colton?
No, we didn't plan it at all. I actually went to the doctor thinking something was going on with my lupus. And here's the baby. Boop. Yeah. So it's something.
You're like, my lupus is acting up. Hold on, that's the whole time.
I'm like, I'm tired. I'm like, okay, well, maybe it's gonna kick into a second, overdrive or something, because I'm always tired. And I was like, no, there's a baby right here on the screen. I was like, oh, wow. So, yeah.
Yeah.
When you have lupus and you have kids, people always ask about, testing and what you're going to teach your kid. How are you going to have conversations around lupus when your kids are older?
Well, they're pretty of age now. I have 16, 12, 9, and then I have a newborn. So they know what lupus is. I teach them, days that I'm not feeling so good. Some days mama needs to stay in the bed. Some days I just can't get up and go like we want to, So they know how to manage it, with me. But I have been telling them, when they do get of age, my oldest, she's 16. So we're planning on getting her tested for probably sometime this year. And I'm going to do the same with the rest, because when Kendall was born, the third child, when I was diagnosed with lupus, he actually had neonatal lupus. And so that first year, we were in the hospital with him, rheumatologist appointments, just to make sure that he wasn't, he didn't have it. So after that first year, his body kind of built up its own immune system, and he's been fine since. But I still want to get them tested going forward, just in case, and catch it early so it's more manageable.
And Dr. Mika, can you just bring in that, like, what's neonatal lupus for those that are listening that are like, what's that? A baby got lupus?
Yeah, there's so many categories of lupus. What we're usually talking about today and on the show is systemic lupus erythematosus, which is really a systemic process that can affect, different organs, your joints. But sometimes people can have skin-limited lupus, and sometimes children or newborns can have symptoms that are consistent with lupus that are really only limited to a certain time period. So that's what sounds like LaMesha is talking about. So it's actually this huge term that can mean a lot of different things. But for the purpose of this show and LaMesha and yourself, Chanel, we're really talking about systemic lupus.
Thank you. Just wanted to make sure we were all on the same page, because that does come up, neonatal lupus, and I want, definitely know that there's somebody like, what my baby will be born with, and thank you, LaMesha, for saying that, your son is fine, and that those symptoms faded. But go ahead, Dr. Mika. I see you had a question.
Well, my big question, because I think this is what always comes up, is people are just confused about who they go to. They're not feeling well, and they want to know if they should be reaching out to their OB or me, and I'm not on your end. So what was more helpful for you? Like when you weren't feeling well, you're trying to figure out, are these pregnancy symptoms? Are these lupus symptoms? Like who were you talking to?
Well, I know the difference. So when I noticed with my lupus, I have more problems like with chest pains and lung pleurisy. So I know if my chest is feeling tight or if I'm feeling lung pleurisy, I need to call my primary care doctor, or I'll call my roomie. But if I'm feeling like cramping or anything like that, I know to call my OB. And so that was just the difference with me.
Yeah, it sounds like you're a veteran and you've had multiple pregnancies, so you really know. But I guess the other big question is, how did you manage between the two? Because you're already going to 1 million appointments when you're pregnant. So how did you kind of balance that every week?
Yeah, so with my job, they give us a weekday off, and then we be off on the weekend as well. So the day I would be off on Tuesdays, I would normally have my doctor's appointment. So I would schedule all my doctor's appointments every Tuesday. I would have maybe 2 every Tuesday. So that's how it would be, and it pretty worked out. It worked out pretty well because not my primary care doctor, but my OB and my specialist, they were like right around the corner from each other. So I would leave one appointment maybe like at 11:30. I'll be at the next one like at 12 o'clock. So it worked out for me.
You seem like you stacked it all well. And
yeah, I run off a schedule. I have like a book, a calendar, and I write, because if it's just me with his brain, it's not gonna work.
That's real. Pregnancy brain,
yeah, and
lupus
brain,
together.
His brain fogs a lot with lupus, so you have to write something down.
That's good advice. Can we see your beautiful baby one more time before we bring in our next guest?
Yes.
Oh, she's out.
Yeah, she's out of it.
I'm jealous. I want a nap too.
Well, thank you to you, LaMesha and Colton. The two of you are so beautiful together. And we just want to bring in some more guests. So we're about to meet our dynamic duo of twins.
Yes, twins are so special. I very much, as a child, wanted a twin. They get to share about everything, but our twins are sharing everything as well as sharing lupus. So we're going to welcome to the virtual stage Sherita and Talia.
Hello.
How are you doing? Oh my goodness. So if you haven't already guessed, everyone, they are identical twins. You see that whole face right there, right? And just celebrated their, can I say the age? 45th birthday, August 4th. Oh, y'all are fly. That was a nice trip. Okay. So, like many things about the two of you that are the same. They both have lupus. Now, okay. Between the two of you, please, I'm gonna poke. Who's the oldest again? Sherita, you're the oldest, right?
Yeah.
2 minutes old. So please tell me a little bit about your sister.
Oh my God, my sister is the dopest playwright I have ever met in my life. I mean, this girl. We have a joke about 2 items, and so I will tell her, I want you to do a play production about a popsicle sticks and a can of soda, and she will literally in 5 minutes have a full treatment about popsicle sticks and a can of soda. I mean, and she's really great at it. So I absolutely love her. She is my best friend, and she's so. Oh my God, Talia, did you really get that?
I'm about to cry. I see.
Oh my God,
so we got to switch places. Talia, tell me something about Sherita. Tell me about your sister.
Sherita is the dopest graphic designer on this side of planet Earth. Literally, her California grill, when it comes to working with anyone, like it started out as just something that she developed as, taking graphics off a wall, and it literally developed into her doing celebrity graphic design and branding. There's nothing that Sherita can't touch that she doesn't make magical, period. Like, just period. Like, she's amazing.
I love how y'all bigging each other businesses up and you're
so much sister love. I have a sister and I'm seeing the energy. I feel like it's like even more with twins. So clearly you guys are big supporters for each other in your work, your life, your careers. But how has that translated to, your diagnoses and your healthcare and this lupus journey?
Yeah, Doctor. Can I call you Dr. M? Okay. There has been days literally that we call each other and we're flaring around the same time, and there are days where we just can't get out of the bed. Like lupus, if you understand it, if you know it, if you have it, some days you're just so exhausted, the tiredness, the flares. And so I think just having my twin having lupus at the same time that I have lupus allows us to be each other's best friend, in the sense of knowing when we can be empathetic with one another and give each other grace, because we still have to live regular lives in the midst of having this. So it's just been a godsend to have my twin sister have the exact same thing that I have.
Wow, that's beautiful. So tell me, who was diagnosed first?
We were actually diagnosed together.
At the same time.
Wow.
We were
Or the same doctor, or how
yeah.
did that happen?
Well, the thing is, because we were preemies and we, of course, we are twins, and so they will always take us through a battery of tests and test us ever since we were little kids, from everything from diabetes to, I mean, just everything. They would just test us for everything. I felt like we were like the the doublemint twin guinea pigs. And so, as a part of the battery of tests that we had right before we graduated from high school, a rheumatologist came in and said, "Hey, I just want, we're just doing a lot of tests. We were already had tested for being pre-diabetic because a lot of people in our family are diabetic, so that was natural." And then they said, "Well, let's test them for lupus," and they did the battery of tests, and both came back that we had lupus. And come to find out that our brother, who actually just died of having lupus,
Sorry.
so we are the only three in our family right now that currently have it.
Oh, sending you all love. Sending you all love.
Thank you.
I mean, but also moving into the space, then you both got pregnant. So you both got lupus, and then both got pregnant at the same dang time.
Well, yeah, pregnant at the same time, about a year apart from each other. And yeah, but it was very, very close in age. So yeah.
Got it. And so we're going to definitely make sure. Thank you for sharing your journey, especially as twins. I think that that's an interesting story there. We're going to hear both of your baby stories a little bit later, okay, in tonight's Better Together game. And everyone that's listening and watching at home, you'll be able to play this at home too. Okay. So, but with that, we're going to actually, you know what? We're gonna go straight to these baby stories. Let's hear a little bit that happened. I'm so sorry. I just realized this, that we have to actually go into these baby stories here. So, who got pregnant first? Was it planned? She's like, wherever she is. So, Sherita, you were pregnant first. And how was that? How was that situation? What was your reaction when you first found? I love these pictures. I definitely had that hairstyle. But please tell me, like, how was the experience finding out you were pregnant, and was it planned, and what was your reaction?
Yes, so I did get pregnant first. It was not planned, and the first person who actually found out that I was pregnant was Talia. Because we were at Burger King, and I was just really, really sick. I was really, really tired. I can completely connect with your story when you said you couldn't even pick up the baby because the baby felt so heavy. Like, when I got pregnant, I just felt like I just couldn't pick up a can of soda. I had no strength in my body. And I told my sister something was wrong, and I knew about my lupus symptoms. So again, I thought it was lupus. I was like, something's wrong. So we were in Burger King, and I completely threw up. And she said, just take a pregnancy test. I was like, why would I do that? I'm like, I'm not pregnant. I'm just I'm just flaring, right? So I took the pregnancy test, and lo and behold, I was pregnant.
There we go.
Wow.
And next up, so how was this for you, Talia?
For me, for my first pregnancy, it was not planned at all. It was in regards to my lupus, it wasn't bad. I think I was in remission during that time. My lupus really didn't flare up to my third child. So I have 3 girls, and the first one was fine. The second one was pretty decent. The third one, it took me out, guys. I had to have 3 pillows, and I had to lay on the floor. I lost a lot of hair, in the back of my hair. I lost a lot of hair, and I was just in pain constantly. I lost so much weight. I think by the time I had her, I was probably I was running about over 220. I would drop back down to 190. After I had her, I lost so much weight. And so, and from my last pregnancy, they told me, okay, running back, they told me from a period of time between my second child and my third child that I couldn't get pregnant anymore. So taking a lot of hormones, taking a lot of muscle relaxers. In between, I was flaring a lot. It was just horrible for a good couple of years. So they was like, take kids off the table. So, literally within like 6 years after that, I ended up pregnant. And, and I was 40. And, they were telling me that I had so many risks. I was pre-diabetic. I had, my lupus. I had a lot of different complications. For all my children, I had to literally have C-sections for all of them. I could not deliver naturally for any of them. And so literally my last child was a gamble, and so
Talia, tell us more about how that fourth baby, like that pregnancy, was different, because it sounds like I'm sorry, the third one. Tell us more about that.
So when I was basically going in for that pregnancy, one, I was in denial because they told me that I could not have kids at all. Like I said, when I tell you I was on so many different medications, like my lupus flared up so bad that they was just like, don't even consider it. And I was literally on medications literally when I got pregnant with her. And so I literally had to come off some of the medications that I was on. And so I just dealt with a lot of anxiety, dealt with a lot of pain. They even took me off of Tylenol. Like I couldn't take Tylenol. I couldn't take anything. And so I think with my lupus, it was bad because I literally just laid in the bed half the time. They literally had to take me out of work. For a good portion of that, I was on bed rest. And so, yeah, that last one, but she's a blessing.
I know, a child's a surprise. The baby was like, gotcha.
Yeah, so
I think this is such an important point that I want to highlight that you bring up, Talia, because I think people always think pregnancies during lupus is going to be the same. Like it's always going to be more symptoms, or always going to be less symptoms. But just like any pregnancy, each person experiences it differently. And I think you kind of highlight that with each of your pregnancies alone.
Yeah.
No, definitely.
Absolutely. And I'm sorry.
No, go ahead. Please go ahead.
Oh, no, I would have thought that, the first two were like, flying a kite. It was pretty decent, and I had no symptoms. And I think, with the lupus and everything that I was dealing with age as well, most people would have said, you probably shouldn't consider the pregnancy. And I just couldn't do that. Like her life was precious to me, and her father as well. And so, and one thing she did come up with, which she does has Asperger's, which is a form of autism. But none of my kids tested positive for lupus. And so I'm grateful for that.
So Sherita's there watching you go through all of these pregnancies. So what was different? I'm always interested on the doctor end, like what were those relationships like when she was sick?
When Talia was sick? Oh my God. Well, I think that Talia, this last pregnancy, again, like she said, it really scared me. I was really scared for my sister's life. And I knew that her lupus was like on full blast at this time. And I was just like, children are such a blessing. But I'm like, Talia, why? You're 40. And she was literally pregnant on our 40th birthday, and we still went out and stuff like that. But I think that, having a baby is such a blessing. I was just scared for her life at that point because there was just so many complications.
Yeah.
And her losing so much weight, and then her losing her hair. And, one thing that a lot of people don't talk about is just that they liken lupus to almost having cancer. There are patients who have gone through chemo and radiation, and it's just so many things. And so I think that having the last baby for me, for her, it was just scary. I was so grateful when she did come to the hospital with the last baby, and was with her, and just standing there by her side and just wanting to know that she was okay during that entire process.
I definitely say if you are a woman with lupus or autoimmune disease, You need a village. You need people around you that will support you, and because there are days where it almost feels like after you have the baby, and LaMesha could probably attest to this, you almost have like a form of postpartum depression, but it's almost like post lupus depression when it comes to a baby. I don't even know if that's the term, but you're dealing with pain, you're dealing with flares, you're dealing with a new baby, you're trying to balance the depression that you're going through, and you need good people around you, so I'll definitely say that it takes literally a village when you do have autoimmune disease.
I mean, it takes a village for everyone, but definitely,
Yeah.
having a chronic illness elevates that. And we had a viewer question actually, and I'm just curious: did any of you? I don't know what the process was for you around doctors, but someone asked if you actually had anyone, and maybe LaMesha, if you want to add to this, did any of you consider a doula? I know that's another popular form of support for pregnancy.
I had one my last pregnancy with Colton, but when they scheduled me, I was due June 15th. They scheduled my induction June 5th. My water broke May 25th at 4 o'clock in the morning. I was in labor maybe 20 minutes, so she didn't have time.
Oh, so you had a whole doula and she had nothing to do because
it went quick. Yeah, it went quick.
That is a blessing. I'm wishing that on my niece who's pregnant right now and ready to do any time. Sherita, I saw you nodding your head. Did you consider a doula, or did you have a doula?
I did consider a doula, but because, again, just like Talia, I had to have all my children C-section as well. I didn't get that far. I would have loved to have had one. I would have loved to have kids naturally. But neither Talia or I could have kids naturally as well.
Okay. So just for people who don't know who a doula is, this is a support person you can have during your birth, but actually sometimes doulas are people who help throughout your whole pregnancy in terms of, getting comfortable, trying to find ways to think through stressful situations, just really like a non-medical but support person.
Right. And I would tell any woman that is pregnant to get one, especially women of color, because we have a higher risk of mortality. I'm sorry, brain fog. Mortality when it comes down to having babies. So I encourage everyone, if you're pregnant, always get a doula, because you want that advocacy in the room for you. Because besides my husband, it was just me and him in there, and I had to get a blood transfusion where I was out of it. I kind of passed out. So I didn't have anyone besides him in there, advocating for me, speaking for me. So you want to always implement a doula if you're pregnant. I would say that.
I have a question. Just throwing this out there. What was your relationship to your OBGYN before getting diagnosed? Where before having a baby? Like was that someplace that you were actively going, or did it just kind of was it like a search to find the right OBGYN?
With me?
Anyone?
Me and my OB, I actually had two. So one I wasn't that close to, but the other one, my specialist, she was the one I was closest to, and I felt like she had my best interest. So I was more lenient towards her than I was my primary OB. So actually, when I went to deliver, I went with my specialist versus my primary care OB, because I felt like she had my best interest.
So are you talking about your high risk OB? You had one who takes care. So, there are some, and we'll have an OB talk about this soon, but some obstetricians specialize in taking care of what we would call high risk pregnancies. And often we manage lupus like that because we want to make sure you're extra safe during the pregnancy.
I also have the same thing here.
Same thing. And I'm curious, this is another viewer question. They wanted to follow up and make sure, because I think we have some real interest in the doula experience, which is a beautiful thing. More people in your community. Did anyone find that their insurance covered a doula, or was that something that was out of pocket, if you don't mind answering?
Doulas for my insurance. I'm sorry. Go ahead.
Oh, go ahead. My insurance didn't cover mine. I actually found my doula. Her program that she was with was actually doing like kind of like a special, or they was looking for people of different, that had like different diseases, you know. So all they wanted from me was like my health records, you know. They wanted like people with lupus, so it was kind of like a study. So that's how I found my doula.
And Sherita, what about you?
No, I was just gonna say my insurance did not cover a doula, and I think that, I mean, I had my kids 20 plus years ago, and so a lot of the recommendations back then was very scant in regards to what's available to us now. And so and I just want to answer the question about my my OB. I had a male doctor, and he was very sensitive to patients with lupus, but he was also my primary OB, and so he actually delivered both of my kids because I really felt comfortable with him understanding who I am, what my sensitivities were, and then also, of course, me, you know, having my children and being in that sensitive situation. So yeah, I wish a doula was covered back then, but it wasn't.
I mean, that's, of course, I think these resources are definitely way more common and common knowledge for folk. And there's also a lot, I think it was really helpful to hear, LaMesha, that there's also sometimes there are programs that support, you know, doulas in different ways, being an advocate there. While insurance doesn't cover it, you know, it might be something that someone can consider as a worthy investment if they do need that extra support.
Mm-hmm.
So, you know, to both of you, I think, you know, we're at time. We're going to go to the next person, but I think the next person is going to bring some context to some of the conversation that we have right now. So now when you're pregnant with lupus, we know that a doctor can be a literal lifeline, and we're about to find out how. So I'm going to welcome to the virtual stage OBGYN, Dr. Afriye Amerson, also known as Dr. A. Dr. A has been delivering babies for 20 years and educating women on women's health. Dr. A, welcome to Better Together. We're so excited to have you here.
Thank
Hi,
you.
Dr.
I'm so
A.
excited to be here, and thank you, ladies, for sharing your stories. They're just amazing and very educational for your audience.
Thank you.
So
I mean,
true.
we're so happy to have you too, because, oh, hold on one second. Got a little technical moment happening. Make sure she gets back in. But speaking
So
of
before Dr. A pops back in, we could talk a little bit about why it's so important she's on our show today. And that is because you've probably all heard the statistic, but you know, 90% of people with lupus are women. So 9 out of 10 people is the statistic you guys will hear all the time. And I think this is really important to think about, because this means that not only are we thinking about women, but we're thinking about women who are childbearing age. And we actually see lupus develop more in your 20s, 30s, and 40s. So those are your childbearing years. So this makes this discussion with Dr. A and talking with your OB so important, because reproductive health is really a big part of what we need to consider when we're talking about holistic lupus care. And you'll hear Chanel and I talk about all the time. And it's really interesting that you mentioned, Chanel, that wasn't something you were really considering as part of, you know, the conversation with your rheumatologist.
Yeah, no, I never thought about the fact that I have to have a conversation with my rheumatologist about family planning and pregnancy. And I won't even lie, while we're going to definitely talk about pregnancy, I'm going to pick your brain, Dr. A, about like not getting pregnant, because that's an important conversation that I want to know. So, but as we talk about this, you know, since you've been practicing for quite a while. And so, you know, you got a long history of work in this field. What's changed about gynecology since you started practicing, and what maybe hasn't?
Excellent question. Well, in the past 20 years, we've made a lot of progress in prevention of female cancer, particularly cervical cancer. What we really have not made forward progress in is decreasing preterm delivery, and also specifically with regards to Black women. Our morbidity and mortality is still astronomically high and disproportionate. So I love the fact that on this forum, you know, we have African American women talking about how they've been impacted by lack of diagnosis, misdiagnosis, late diagnosis, and then successful management of pregnancy during lupus. because it really does take the advanced forward thinking to make that happen. So we're still being affected disproportionately, which makes this forum all the more important.
Well, thank you for saying that. And I'm so happy you are excited about this conversation, because Shell and I get excited all the time to have all these women sharing their stories. You know, we really want your input, because we've been trying to talk about, you know, what is our role as mine as a rheumatologist and yours as an OBGYN when we think about someone who's diagnosed with lupus and is pregnant.
Well, as you've said previously in the show, it's very important to have the collaborative care. A person is, number one, got to have management of their medications. And certainly better pregnancy outcomes are associated with patients who are pre-pregnancy placed on the proper medication, specifically hydroxychloroquine. And when patients are on that prior to their pregnancy, the pregnancy outcome is significantly better. But as you know, patients with lupus can face problems with kidney disease, problems with blood pressure management, and this can affect fetal growth. So it really takes a collaborative team, and that monitoring is progressive throughout the pregnancy to really have a healthy outcome for the mother and the baby.
So,
Thank
Dr.
you.
Go ahead.
Really quickly, just because I want to make sure our viewers are hearing, while we might have mentioned different medications, just so you know, these are not recommendations specifically for anyone. Everyone, please talk to your doctor specifically about anything that would work for your best benefit. Just so you know, and we really try not to mention specific drugs, just so no one goes, doctor, put me on this thing. But thank you. That was such a really, really good, like important factor to consider for those thinking about being pregnant.
I think that the term like high risk, I wanted to focus on that, is always like a question. I also think a stressful moment too. And then, you know, one of the twins also brought in like advanced age and what we consider like geriatric pregnancies. Can you speak a little bit on that, Dr. A?
Yeah, so any pregnancy beyond 35 years old is considered advanced maternal age. And so that is where all risk factors are increased. And that can be from infertility to high risk for blood pressure, diabetes, preterm delivery, stillbirth. And certainly when a person has chronic conditions coupled with that, then those risk factors are even exacerbated. So the counseling is really to work with your primary care provider, your specialist, to make sure that A, you're in remission, and B, that you're on medications that are thought to be healthy in pregnancy. Because at those advanced ages, your risks are certainly multiplied.
Thank you. And I think another question that a lot of times people have around the part of it, and like I said, I was like, I'm gonna be selfish because I'm not trying to have a baby right now. But if I'm avoiding that and I have lupus, you know, are there options for me to not, you know, to avoid pregnancy? And because I know that a lot of times they say, oh no, to birth control. Are there options? And without saying specific, but you know, maybe just the general terms.
Well, birth control is the very broad option that's available. And certainly if a woman is dealing with a chronic illness, lupus and other conditions, she wants to have management of her preconception planning. So that means she wants to arm herself broadly with what are the options in terms of contraception that are going to best apply to her. That way she can have thorough pre-pregnancy planning prior to actually having a pregnancy. And again, that's associated with her having a better outcome. All of this is really about not having premature delivery, reducing her risk for miscarriage and stillbirth, and making sure that she's healthy from the standpoint of her organs, such as her kidneys, and things such as her chronic management of blood pressure.
Thank you. Thank you. And are hormonal options, birth control options, are they allowed or for people living with lupus?
So absolutely, depending on the individual woman and what medication she's requiring and whether or not she is having a flare or in remission, she can absolutely explore hormonal options. So whether that is something that's oral or whether that's something that she's taking injected form or a form that's placed in her body really depends on her specific medical condition, where she's at with the chronic illness, and what other conditions may impact her health.
Yeah, I mean, I think you're both getting at a really good point because people come to the office and see me and they've, seen another physician said, you have lupus, you can't be on birth control. And so I think that, how what Dr. Amerson is saying, it's so important that we're considering patients case by case, and it changes person to person. So while someone who maybe has really uncontrolled lupus or is newly diagnosed, we might say this isn't the best time to start something. Someone else who's in remission and is very stable, it may be a good option.
Mm-hmm.
Awesome. And so right now, I'm just curious on another question. What should we be what should our plan be, if we are not plan B? That's not what I was looking for. Got that? Did that by accident, but it worked. What does planning look like in the process of like, if I am things outside of me controlling my things, should I have how early should I have that conversation with a OBGYN?
Excellent question. So someone who has a chronic condition such as lupus really wants to have some preconception planning up to 6 months in advance of an actual pregnancy. That will allow them to stop any medications that may not be advised in the pregnancy up to 3 months in advance of the actual pregnancy. That will also allow some basic behavioral social dynamic changes, such as reducing her caffeine intake, beginning to take folic acid, making sure that she's getting a balanced nutrition, making sure that she's having an otherwise healthful living, quit smoking, eliminate alcohol intake. All of these basic things allow her body to be at a reduced risk for the complications that can occur in pregnancy.
Thank you. Important information. So now we're going to move into this other final segment that we're bringing in and introducing to this show, BTG, which is our virtual guest event. Now we're going to all have a little question. So Dr. Michaela, you ready?
Yeah, let's go.
All right. So time for, Dr. Michaela is also someone that has had a child. So you all can participate. I am going to be the moderator because I have none. So let's see how much our guests know about having babies. And also who's been paying attention, because Dr. A definitely said a couple of these answers in this game. So play at home too. See if you can guess that. Feel free to use the chat in here. So we're going to go to PNP. Right, which was just shared right now, but I want to open this up to everybody. So PNP is the game question. Prenatal planning. Medical experts say if you are managing lupus, as just said by Dr. A, you should start planning your pregnancy at least 6 months in advance. Now, here's the question. Give me a thumbs up if you did. Thumbs side if you were like close to that, a thumbs down if you maybe didn't do this. Who here planned their pregnancy 6 months in advance? So we had a few people that were kind of like around there, but
I'm like, yeah, I'm like on this page.
Applying a couple in. Anybody, what was I know that we had a couple surprise pregnancies that happened. But I see LaMesha, I'm just curious, or LaMesha, was there anything that you thought about before getting pregnant?
No, we had conversations about it like after we got married, but she came before, so no.
Well, it's good for everyone out there to know you got 6 months to really get it all set up. Dr. A, any thoughts about that?
Well, the real importance, as I said earlier in the show, is really reducing the risk for complications. So again, thankfully, we often will have a wonderful pregnancy outcome. A baby that's healthy is the ultimate point. But there are outcomes that we seek to prevent. So stillbirth, premature birth, and babies that ultimately will go to the ICU is what we want to reduce. So by working with your conglomerate team of consultants and your OBGYN, you make sure that your contraceptive planning and your pregnancy planning sets you up for the lowest possible risk of complications in your pregnancy. That's the ideal. We can't always reach that, but it's a goal for us to set, especially in chronic illness.
Awesome. Thank you.
Mhm.
I was going to say, Dr. Mika, you want to take the next question or you want me to hold it down?
No, go ahead. You're doing well. I like being in it.
You're like, oh, yeah. You get to be all in it. That's perfect. So we're going to go on to H2O, water intake. So now it is recommended that you drink 8 to 12 cups or at least 2 liters of water every day. Now, we know water intake is most important in your 3rd trimester. So thumbs up, thumbs sideways, thumbs down. Who drank 8 to 12 cups of water a day?
Yes, I love water. I absolutely love water. I'm a fish.
Water. Crazy.
You would drink, you were a fish. You were just a fish.
Mm-hmm.
What about
Yeah.
you?
Mm-hmm.
I saw a thumbs down, LaMesha. Or you were just not, that wasn't your drink of choice.
Not every day. I'm not going to say every day. Some days, most days, but not every day.
That's fair. That's fair. Dr. Mika, what was your drinking like?
I'm awful. I had to start carrying a water bottle in my white coat and like making sure and like setting alarms. I'm not good at it.
And Dr. A, why is water important, especially that first trimester?
Well, I want to commend the women on their honesty because it's definitely not an easy thing to hit that 2-liter mark every day. But it's exceptionally important because the embryo in those first 3 months is really overwhelmingly fluid. The fetal growth really doesn't accelerate until the 3rd trimester. So the cellular well-being, as well as the overall woman's well-being, she may be struggling with anemia or other conditions affecting high blood pressure and chronic kidney disease. So making sure that she has adequate hydration, number one, reduces her risk for further complications in the pregnancy. Secondly, it equips her body to combat dehydration and maintain a healthy well-being in the pregnancy state.
Awesome. And I think this was an amazing conversation that we had here. And just wanting to bring it to space, we're going to go through some final thoughts. But Dr. A, what do you think is your big takeaway from this show? If you could leave one thing for everyone to think about, what would it be?
Well, I think, again, the guests really very nicely depicted the true importance of planning when it comes to chronic illness and pregnancy. It's very important, ideally, that a person be in remission. The outcome during your pregnancy will certainly be greatly improved if you're in a remission state. Secondly, that you have a consultant team and that team is working collaboratively to monitor your blood pressure, monitor your kidneys, monitor your fetal growth, again, to optimize what's the outcome for mother and baby during the pregnancy. So I love the fact that we're broadcasting what the key steps are to optimize pregnancy outcome and reverse adverse circumstances.
Thank you, Dr. A. Your input has been so helpful. I am just struck with how many powerful women we have in here. I've been through pregnancy. I have not done it with lupus, so more power to all of you. Thank you, Talia, Sherita, LaMesha, and baby Colton. I'd just like everyone to know that, again, Biogen is really bringing us all together tonight. If anyone is interested in getting more information about lupus or participating in clinical trials, please go to biogentriallink.com. Take it away, Chanel.
I was going to say, please join us on our next episode, September 12th. 6 p.m. So we'll see you there. We're going to be talking about health equity. And yeah, I'm going to perform a poem. When my sister held my nephew within her body, it was the first time that I saw magic. I never realized how organs shift inside, rearranging itself for the space to build infinity. The body is a wonder. You conjurer of bone of flesh, crocheting DNA to add to the diversity of beauty in human history. You womb, we thank you. You womb, we honor you for the way you continuously make this world new. As you hold the tiny finger, count the tiny toes, please hold on to the joy. Please know that you, my dear, are a miracle made manifest. Thank you. See you September 12th. Have a great night.